Well, for the first time in months, Governor Holcomb joined state health leaders for an update on the COVID spread across Indiana. Our Emily Longnecker has the top 3 takeaways, including plans in the works for schools before the return for the spring semester.
There was a lot to unpack from Wednesday's COVID update from the governor and state health leaders. Here are the top 3 takeaways for you and your family. The Omicron variant is here, the first case discovered just 11 days ago. Delta is still the dominant variant in COVID cases in Indiana, but that's expected to shift quickly because of how contagious Omicron is shaping up to be. Even those who are fully vaccinated and have their booster can still spread Omicron, even if they show no symptoms.
As the Omicron variant sweeps across the U.S., it is more important than ever that people use the tools available to reduce the spread of COVID-19. We have those tools in ample supply: masks, hand hygiene, staying home if you're sick, and getting vaccinated and boosted.
The state's getting in more therapeutics to treat COVID, but in limited supply. The antiviral drug from Merck that just got emergency use authorization from the FDA treats mild to moderate COVID-19 symptoms in people 18 and older. To get it, you need to be at high risk of serious illness and get a doctor's prescription. Almost 5,000 courses arrived Thursday at select CVS and Walmarts across the state. Pfizer's antiviral pills are available for high-risk patients 12 years and older. Just over 1,000 treatments went to hospitals across the state. They, too, are in short supply. And a monoclonal antibody treatment from AstraZeneca went to transplant centers and will soon be available at cancer centers. This treatment is for patients 12 and older who don't have an immune response to the COVID vaccine. Right now, it's also in limited supply, with 960 doses being delivered this week.
There is simply not enough medicine to go around right now, and do not bank on being able to get a therapeutic when you need it. It will take time to increase supplies and distribute these treatments, and none of them are 100% effective. Vaccination remains our #1 defense of preventing severe illness.
Finally, when it comes to your kids heading back to school in 2022, there's no official new guidance on quarantining from the CDC. The state will hold a webinar Thursday with school nurses and local health departments to determine what could come next with the impending surge because of the highly contagious Omicron variant. But state health officials say cases in school-age children are at the highest level they've seen in months. We'll be following that webinar Thursday, and we'll let you know how it could affect your kids heading back to school in the new year.
Dr. Box also noted the shortage of rapid tests and the very limited supply of medication to treat COVID. That's a big problem with case numbers growing fast. Nearly 8,000 people were diagnosed just Tuesday. That's the 3rd highest one-day total here in Indiana for the entire pandemic. The other 2 days were over 8,000. They were more than 2 years ago. In the peak, which is last November and December, check that, that's last year. This comes as the number of available ICU beds in Indiana is dropping. More people are filling them up. On Tuesday, the state board reported there were less than 13% of available beds, so about 260 staffed beds statewide. Just this afternoon, that number, of course, well, yesterday afternoon, that number dropped again. Now only 9.2% of the beds are available. Fewer than 200 staffed ICU beds for Hoosiers.
That's not a lot of beds. If you have a heart attack, you have a car accident, somebody needs one of those beds. There's really not many beds, if any at all, in some hospitals available right now.
Now, we're talking about staff beds. The number fluctuates based on the number of doctors, nurses, and other healthcare workers that are available to work.